To start off, we're going to go through apologies and change membership. So most of it's no longer a member. I drop myself is received apologies from through council and counselling who and council. Agenda point 2, minutes. Do we have any comments or and a seconder and show of hands. And do we have any declarations of interest? Okay. So now we go on to the election of a vice chairman. Do we have any nominations?
Thank you, Chair. I'd like to nominate Councillor John Nicholson.
Vote. Councillor Nicholson.
Chairman, with your indulgence, healthcare, bold and techniques, standing move, change, adapting the way press. We're going through such a major reorganisation at present, merging of resources between hospitals and a total restructure of the across. Whilst we trust the assurance that these new structures ever complacency, science does not serve well. Through complacency, science perhaps born back of culture. No, the significant scandals have been allowed to arise within the health sector. Scandals may well ask, where was scrutiny?
Councillor Nicholson, could you bring your mic?
Did they not see what was happening? Did they not know? Why did they miss something that had grown so big? They did. What is the point of scrutiny? Valid questions serve us ideal, but the practice is far from ideal, as indeed is in many political systems and functions. Scrutiny committees are made up of councillors who may be amateur in the field. They have no relevant qualifications, but nevertheless want to make a difference. Some may have little experience or may not be aware of their shortcomings in any field. Some, by the nature of the job, may overestimate their importance, driven by egotistical quest and examples of Dunning-Kruger syndrome. As such, we could be seen by health professionals as interfering imbeciles. You perhaps all enforced by the trend political tribalism to take priority over best rational use of human resource. Yet, amidst all this, we still have an important function to perform. As the last bastion of public accountability of question and reason, although analysis of our own composition may be at divergence to these standards. It is from this background that I express concern in the current direction of the health services. The lack of integration being demonstrated in regard to inclusion of local authorities in the Integrated Care Board partnership, which perhaps follows principles of equality more akin to those in Animal Farm, being done by a Leviathan. The focus on acute care rather than prevention, the voice of public health being sidelined as ever. The lack of accessibility, particularly in our own Hampshire and Isle of Wight ICB, who's undergoing yet another cost-cutting reorganisation, renders its officers uncontactable in practical terms and the decision makers unreachable in the faceless, lofty heights of nebulosa. A seasoned observer of humanity and structures that we build said two things that are of relevance here. That as humans, we can build our dreams, but mastering a dream is a great challenge because humans so easily become slaves to their dreams. The other was that an organisation formed to serve an external purpose in the beginning is focused on the delivery of its service. But as it matures, it develops. As it develops, its focus can turn to its own survival and benefit, to the extent that the original purpose of its being may be diminished, treated for all intents and purposes as an inconvenience. Those who've been around for a while and seen organisations come and go, wax and wane, will recognise this trait and share my concern. And if we do nothing else in scrutiny, we must raise awareness of such risks, questioning behaviours, and in doing so, help keep our service on track. Members, partners, I call on your consciences, your awareness and integrity to be vigilant and proactive in the safeguarding of the direction and implementation of the service ideal that we aspire to practice inclusivity, openness, review what we are delivering to the best effect that we can. Thank you.
Thank you, Councillor Nicholson. Shall we proceed to a vote? So those who would like to vote for Councillor John Nicholson. Councillor Nicholson.
Yep.
Yep. Thank you. We go on to agenda point number 5, which is public question time, and I believe we have a Mr. Richard Knowles in the audience. So what I'm going to do, Mr. Knowles, is I'm going to read your written question and the response, and then give you an opportunity to ask a supplementary question if you'd like. Okay, so the question that Mr. Knowles put to the committee, since the last meeting and the committee chair's acknowledgement that the current situation regarding availability of sharps bins and their fitness for purpose is unacceptable, please describe the process undertaken and progress made since the last meeting to resolve the situation. We received a response from, I believe, the Director of Community Services, and the response is as follows. The Council contacted Mr. Knowles last week to provide assurances that work is being progressed to find a suitable solution to the issues he and others have highlighted. Unfortunately, due to staff vacancies in a small council team, a solution to these issues has taken much longer than would be expected. A number of actions are now being progressed, including a review of the current pharmacy take-back scheme, including contacting pharmacies through the Island Community Pharmacy Coordinator to determine which of them are still able to participate in the Sharps take-back scheme and can provide replacement bins. This includes ensuring those pharmacies participating can store the requisite number of larger 5 or 7 litre bins. A revised list of participating pharmacies, identifying those with the facility to accept 5 litre and 7 litre boxes, will be drawn up and provided for information on the council website. Relevant information is being obtained to determine what, if any, gaps there are likely to be in service provision for those who are not able to access the revised list of pharmacies. This information will be used to draw up a business case for proposed additional door-to-door collection service that sits alongside the take-back scheme, but would be in addition to the current collection service for clinical waste. Such a service may attract a charge for users to cover the additional costs of sharp bins collection and the provision of replacement bins. This coincides with a review of the current contractual arrangements made to a third party via Thalia, the council's waste and recycling contractor. Mr. Knowles, do you have a supplementary question? Thank you, Mr. Knowles. So to summarise, your question is what are people to do now, and if the website will be updated? Is that a summary of the question? Thank you. Thank you. So for your question, we'll have to go back to waste and provide a written response to you later, so we can get that done for you. Does anyone else on the committee have anything they want to add to that point? Yes, Ms. Smith.
Chairman, this is a wholly unacceptable situation, because this committee highlighted this, I think it was a couple of years ago, when a resident contacted me with exactly the same problems. And we then went down for several months saying it's their fault. And then we've clearly established, I think 2 meetings ago, that responsibility, thanks to Dr. Legg, firmly sits with the Isle of Wight Council Waste Department. So I really can't see, apart from finding the costs, and we know the council is strapped for cash, but this is not an acceptable situation. It is potentially hazardous, and we should be facing up to it and responsibly dealing with it by offering the service.
Michelle?
Hello, can you hear me all right?
Yeah, go ahead.
Fantastic. I won't mention the person that I've been liaising with in the council, because I'm not quite sure whether that's appropriate or not, but I have had lots of meetings with said person, and we were moving it forward quite well. I think that she is off sick now, which is why I didn't want to mention her name, but we have done, just to reassure people, we have done quite a lot of work in the background. Yes, it is definitely Isle of Wight Council's responsibility for waste disposal. And then the question is how we store the larger bins, which people are requiring now because of the change in how people monitor their diabetes. They need much more equipment and they need to dispose of that. So we need 5-litre bins, and we need to make sure that the pharmacists can store those safely and then get them collected. So I do think there's something about, there has been quite a lot of work done. I'm not quite sure where it is at the moment, because I do think somebody's off sick, as I've said. So I didn't want people to not to think that things hadn't been done with the council and health partners.
Thank you, Michelle. Councillor Jarman?
Yes, I noticed the word pharmacy came out there. I'll talk from personal experience just in the last week, although it's been a recurring theme. I've been with Sharps buckets to local pharmacies in the West White, and they all inform me that they no longer take Sharps buckets. We therefore went to the hospital, and we went to the pharmacy in the hospital just inside the main door on the left-hand side. They told us that they no longer take Sharps buckets either, as of about a month ago. They referred us to PALS. We went to PALS at the front desk. The PALS people knew nothing about this at all, so clearly there's a communications issue going on here. The PALS people referred us back to the pharmacy. Luckily, the pharmacy lady was very helpful, but the bottom line is that we were told eventually the only place we can take them is to the A&E department at the hospital. So we trooped up to the A&E department, and then they sent us up to the, I don't know what it's called, the special care unit. And we went up there, and eventually we found somebody who was a one-off favour, and they made it very clear to us that it was a one-off favour. They would take the Sharps bucket that we had and take it away from us. So clearly this is a systemic problem that is not limited to pharmacies who don't really know what to do except decline them. The hospital pharmacy, which is told to decline them and are declining them, PALS, who haven't got a clue what to do, A&E and other hospital units who also don't know what to do, but are trying their best to help when they can. So it seems to me there's a major communications issue. I don't know who is in charge of this within the health environment, but whoever it is needs to get their act together to sort it out and to make sure that all of those people I've named, all of the people involved in this, know what to do. And it should not be left to patients with Sharps buckets driving around this island, desperately trying to find somebody to take them.
No, I couldn't agree with you more. That is not appropriate. But just to restate, the collection of Sharps lies completely with the council. But the work that we've done would be looking at and making sure that pharmacists are commissioned appropriately for the service. And this hasn't happened previously, because otherwise they will have to store Sharps in an appropriate space whilst waiting for the collection. And the collection is undertaken by the council. But there has been work done on this, and I just think we need to liaise with the person that has been leading on that when she's back at work.
Thank you, Michelle. James, and then I'll bring in Councillor Robertson.
Yeah, just to pick up from Michelle's point, I'm responsible for the Commission of Community Pharmacy, so I'll take it upon myself to come back with a view as to why community pharmacy are no longer the drop-off point for Sharps in that circumstance and what's driving that. So I'll come back with a view from a community pharmacy perspective.
So James, before you do that, perhaps liaise with me, because we've already gone down that route and explored that. Okay, and then I can fill you out why there are issues, and it's space. Because these have to be insured, and from a health and safety point of view, the space has to be appropriately sorted. And you know, if you have 20 people giving off 5-litre, 7-litre bins, that's quite a lot of space. And so, but we'll contact each other outside this meeting, and I can update you.
So just as an action on that, then we'll get a response from Michelle and James to the committee that can be circulated later.
I think it's probably appropriate to get a response from the person that has been dealing with that within the council, and I can, outside this meeting, let you know the name so you can liaise directly.
Okay, thank you. Councillor Robertson.
Yeah, thank you, Chair. Can we just make sure that the answer to the gentleman in the gallery doesn't come back from this council that I'm afraid you'll have to hang on to your sharps for a bit longer because one employee might happen to be ill? I think that's frankly ridiculous for an organisation the size of Isle of Wight Council. So can we try and make sure that's not the response, because I simply don't think that's credible.
I had Councillor Jarman and then Laura.
Well, I appreciate us handing out actions on various people and a delay because people are off sick. And I agree with what Councillor Robinson just said, that we should not be beholden on one person being temporarily absent for the system to fall down and have no answer. The question was well made from the public gallery, and I feel I need to echo that. At the moment, today, this evening, what is the process with people with full sharps buckets? What is the interim measure, the temporary measure, whatever you want to call it? What do they do with their sharps buckets now? Well, all the various organisations, the council et al, debate and wait for people to return and decide what to do about it. We need an interim answer that we can put out on the public domain right now about what people do. It is not tolerable that people are left in doubt about what to do with dangerous materials.
Thank you. Laura?
Thank you, Chairman. I'm very conscious and echo Councillor Jarman and Councillor Robertson's views. I sit here as one of the directors within the local authority and would like to volunteer, albeit outside of my own remit, to take forward an action on behalf of the committee to liaise with the Director of Community and Neighbourhoods tomorrow to ensure that an answer is provided to the committee within the next 7 days to the questions that the gentleman has raised. Those questions, as I understand it, and forgive me, the published question and response is not the question and response you read out, so I'm a bit in the dark here, but the questions as I understand it is what is the interim arrangement for sharps bins in terms of storage and collection, but also what is the arrangement for people who have a I'll use the word stockpile because I'm at a loss as to what else we could call it, of sharps within their own home out in the community for them to surrender those sharps for safe disposal. I will take forward on behalf of the committee both of those questions, if Chairman, that meets with your satisfaction.
I think that sounds like a really good idea. Yes, thank you, Laura.
Sorry, Chair, one further point. People who have full buckets also need to know where to get now new buckets. That is a continuing problem, and people who've got overstuffed buckets is not helpful. And simply as I saw the other day, somebody stacking up used those very long pens. I don't know what they're called, the extra long ones and 6-inch ones, self-delivery ones. Stacking up those on top of full bins is not a healthy issue to find in our community. So can we at the same time urgently identify and put out as a press release, whoever does that, Laura or Simon, somebody, what people should do to obtain new bins where they have a stockpile, to use your word, Laura, of full bins already. Thank you.
So to summarise an action alongside that is to also issue a press release. Can we add that as an action as well? Do we have any other comments? Okay. So agenda point 6, progress update, pages 11 to 12. So we have two actions in progress. I believe on the accessibility standards, there was a response circulated from Natasha Taplin. I presume the committee have all seen that response. Are there any comments on that? Yes, Councillor Nicholson.
Chairman, the response is meaningless because it's just carrying on. I have a patient who regularly rings me up and who regularly gets small print despite it being on his files, despite repeated requests from Portsmouth and St Mary's. I think this is just a totally unacceptable situation. As I commented at the last scrutiny meeting, what faith can we have in the Integrated Care Board or the health services if they can't resolve a simple issue like this?
Are there any other comments on that? The other actions that have been completed is the mental wealth, which I believe we've got an update from Councillor Michael Lilly and Joanna on their visit to Afton Ward.
Thank you, Chair, and congratulations on your first day. In my role as previous Chair, it was arranged by the new Hampshire and Isle of Wight Community and Mental Health Trust, which has now taken over 7 acres. As you know, it was previously a department of St Mary's. It's now under the new trust, and this committee had been looking at the issue of particularly wards regarding dementia or patients with dementia that would also be under section previously of the Shackleton ward, and that was closed down some years ago, and the update of the Afton ward into a ward that included patients with dementia, but also elderly with dementia and elderly with other mental health issues. I and Joanna visited it and were shown around. I think you have to put into context that this ward is completely unique in the whole of the UK, because you would normally just have a dementia ward, or you would have a ward for elderly that had mental health issues. But because of the size of the island and limitations, they have adapted to have one ward for both. But you have to put it in the context. This is unusual. We were I was impressed. That was a huge improvement from previous. The staff team were extremely good and extremely sensitive to the needs of patients, and we had a good talk with the senior members of the team that are now under the new trust. And I think one of the things that they very much urged us was that this committee does very much, call to account the new trust and make sure that very much the Isle of Wight and the needs of Isle of Wight residents are very much taken into consideration, and that they're not lost in this now huge trust with that, because obviously there is a difference of needs of island residents compared to those on the mainland. It's a different scenario. There is a difference with the water surrounding us and the issues that has. It is likely that some patients will end up on the mainland because the facility will not be suitable for certain patients, but they did view that they would try to keep that very much to a minimum. I'll leave it over to Jo to add to that.
Thank you. Yes, the visit was really positive, and it was a really good opportunity to see the ward in action, and to see that people can be cared for on the island, which is really what people want, given the challenges faced when they have to travel to the mainland for the care they need. And just to mention that there's been a lot of work generally around dementia care, both within the new trust and within the council as well. And I can't not mention the Parklands Hub in Cowes, which is a wonderful resource for people across the islands, for people with dementia. So a lot of work's gone on the past 2 years to provide more support for people with dementia. Yes, so we just need to make sure that we remain heading in the right direction, and that people's voices are heard, so that the correct services can be provided.
There's just one thing I'd like to add, Chair. The St Mary's, with the split, that one of the things we identified was you had a Friends of St Mary's, which was, and also there was a St Mary's Charitable Trust. Those structures have actually gone to St Mary's and the Portsmouth Hospital Trust. And actually 7 Acres and mental health services are not left at all with such structures. I did raise the question that we do know that there was money that was specifically for mental health patients, resident service users, to actually make sure that that money isn't lost, because that was money specifically for island residents with mental health issues, and also the need to actually have a Friends of 7 Acres and mental health service, because they're extremely important. So just highlighting that, if that could be minuted to ask that. There was something that staff hadn't realised had actually been lost in the transfer, and it's extremely important. Thank you.
Thank you, Councillor Lee, and thank you, Joanna. The last point on that is the Mountbatten Hospice. The committee wrote to the Chief Executive of the Integrated Care Board regarding Mountbatten seeking an uplift with inflation and the cost of delivering services, but unfortunately have received no response. Are there any other comments or questions on the progress report? Yeah.
Can I just say that, just a follow up from being chair, that's very disappointing that we haven't received a response. And there are serious consequences to this, because the presentation, I think it was my last meeting, from Nigel Hartley, was that would go, 2 things would happen. One, they'd have to actually ask more charitable giving or donations from the population of the Isle of Wight, who already supplied 2/3 of the funding, which will have a spin-off effect to smaller charities, because there's only so much money in the pockets of generous residents. And the other is certain services could be cut. And the services that the hospital give are extremely important and extremely embedded in the community. So I think we really do need, I suggest, that to the committee, as a past chair, that there needs to be some kind of resolution to call for action of that, because that's totally unacceptable and will have huge effects on this one. I hand it over to you, Joe.
Councillor Robson.
Thanks. Yeah, can we ask for a response? Because I think if this committee accepts being ignored, it's going to get worse and will be ignored again.
Yeah, I think that's a good idea, and I think it should not be a closed, a completed and go back onto open. Are there any other last comments on that before we move on? Okay, we're going to move on to agenda point 7, pages 13 to 24. We have an update report. So I believe that the committee has all received a copy of the update paper. So I would like to invite James and Scott to give a summary of that and any other points that you want to point out to the committee. Thank you.
Yeah, so the dental papers, this item, so I'm responsible for dentistry as part of my role as Director of Primary Care for the ICB. I'll take the early part of the paper as read, because what it does is it starts to outline how the national contract works, some of the complexities in terms of that private market and how we work with a range of different providers, some of the circumstances relating to the national contract and how we can influence it. I think the key point to make is that with the dental recovery and reform plan nationally, there's lots of opportunities for us from a commissioning perspective. We will work within that framework and we have to make the best of it. But I think hopefully some of my examples in the second will demonstrate there's absolutely a need to build relationships with local providers and local contractors, understand their needs, understand their objectives, and see if together we can develop a more dynamic provider model. As you go through the paper, there are some statistics, and I think there's some good news, and I say good news in a guarded way. I don't suggest, everything's been solved, but certainly from an Isle of Wight perspective, we are seeing the number of units of dental activity increase in comparison with other parts of Hampshire and the Isle of Wight. Clearly, there's a lot to do, but it is going in the right direction. I think that reflects both the volume of need on the island, so one shouldn't underestimate the challenge we face in terms of meeting that need. But I think what it also reflects is the flexibility of providers on the island to work differently, to operate differently in relation to contracts and increase their capacity to meet demand moving forward. And I think that's a really positive message. In terms of access, you'll see in the paper that we have seen an increase in the number of children seen in the last 6 months compared to the previous period. But we have seen a slight decrease in the number of adults seen from a unit number perspective. But I think the point I'd like to raise there is that actually the average UDA delivery has increased over time. So we are looking at more UDAs despite that decrease in the number of adults being seen. I think what that does, it reflects that we are starting to identify where there are particular pockets of complexity, where there is more urgent dental need, and we're putting in place services to address that. And I think that's a really important point. So whilst from an adult's perspective, numbers appear to be stagnating or going backwards, we are dealing with more complexity and we are being more proactive in dealing with some of those oral health issues moving forward. We know there are challenges with workforce and we know there are issues with recruitment and retention. We do have the opportunity within the contract to look at where we can sort of support with recruitment. That could be golden hellos, that could be support with training and education, that could be through the provision of expenses for travelling and relocation. That's all good, that's practical, that's technical, but I think what we've got to do from an ICB perspective is we've got to create a better environment for our dentists where they can see a progressive system, they can see one that is focused on transformation, they can see a commissioner that has a commitment in them as professionals and wants to see them develop as professionals. And I think what we're trying to be in this is ensure that we use all of the levers that the national contract gives us in terms of payments, golden hellos, support for new entrants, but equally look at how we can develop the next line of dental professionals. We've got the Dental Academy opportunity. I think it's really important we establish a strong link with the island in that regard. And as some of our conversations with Denby House have demonstrated, and we're lucky to have Edward and Helen here today, there are opportunities to do things differently, innovatively, as a way of recruiting and retaining and keeping people in role. So I think that's our biggest opportunity, but it's also our biggest challenge moving forward. In terms of what we're doing, we've got a very clear dental implementation plan. We've identified areas for targeted support, and that is benefiting a number of practices on the Isle of Wight. So we have seen an increase in the number of UDAs being commissioned. We have dispersed contracts that were underperforming in certain parts of the island to those practices that have an ability to service that demand. and develop high levels of performance. And again, we've had conversations with practices like Denby House in terms of how can we build on the existing contract and increase the number of UDAs in year to meet that demand moving forward. There's absolutely a commitment to commission flexibly, but work in partnership with providers to understand their needs and make sure that we're meeting those needs in a more proactive way. You'll be aware of the mobile dental units, and I think that's an example of where we are targeting healthcare inequality at source. We are being flexible in terms of service provision. And in some instances, I think the island's slightly ahead of the game in terms of the way the dental bus has worked and how we've used it to sort of meet that need moving forward. Within our sort of investment strategy for this year, we are looking to increase the number of mobile dental units as a sort of an extension of our service capacity. But equally, we've got to look at how we can commission more static sites as well. So in addition to the dental bus, if we know there's a particular area of need or inequality, how do we develop a more sort of proactive service to meet those needs moving forward? And I think the other thing we are looking at the opportunities to pilot. So obviously with Edward and Helen in the room, we had a successful visit to Denby House in April, and we looked at where we could do things differently in terms of recognising the inequalities that the practices are facing in terms of their upfront demand, recognising that actually can we be slightly more proactive rather than reactive. And I think you made the point earlier in terms of health promotion and addressing need earlier on in the pathway. And there's clearly an opportunity, I think, for oral health promotion, and that particular practice has shown an appetite to do that. And that feels like an obvious place that we can work in partnership with the council, and Simon Bryant's obviously aware as well from a public health perspective. So that feels like an opportunity that will bear fruit over time. I think the other thing we're looking at is how we can ensure that practices are able to access the golden hellos and the supported expense support for new entrants. And I think looking at existing business models and where can we legitimately support as expansion. So it might be where particular dental surgeries are looking to increase the size of their base. They're looking to invest in capital. They're looking to increase the number of consulting rooms. Again, I think there's a good example in Ryde where actually the NHS can work proactively with the town council and look at local solutions to sort of meet that need moving forward. And I think, again, I'll just finish with a final point in terms of if you look at activity February last year to February this year, we have seen a slight increase overall of 6%. That's sort of Bucks national trend, and it's the first time we've sort of seen an increase year on year. So a lot to do, but lots of practical actions underway, but also a willingness to work differently, work innovatively, take solutions forward.
Thank you, James, and thank you for producing this update report. It's very detailed and lots to read through, which I found really useful. I'd like to bring in Edward Day and Helen if you would like to make a comment on that. Sorry, Helen, if you press the little button on the front, the flat ones.
One.
There we go. Thank you.
Yeah, as you say, we do what we can to recruit by taking them straight out of dental school and through the deaneries and the education system to try and mentor dentists through their first year. And then once we find they're actually on the island, it's a lovely place. They want to stay, but it's getting these people over here in the first place. And as you say, the finances of golden hellos are important, really. And even getting into the schools to encourage people to apply for dentistry, go off, do their training and come back. I know it's a long time in the process, but we're starting to see that come through now. So it's yeah, as you say, working with the ICB, hopefully we can start some of these projects to gradually improve the system. So
Thank you very much. Edward?
Hello, everyone. It was just to add to that I've started working with Helen back in February. Took over Denby. One of the things I wasn't aware of until about that time was that Denby is still currently the only fully NHS practice on the island. The big issue with that is that all of the funding that comes in is through the NHS contract. Most of the practices on the island and nationally that hold NHS contracts kind of use them as a loss leader. They're corporate owned and they use them as loss leaders. So they get patients through the door, and obviously that works very well and functions. But then once they've been seen initially, the only opportunity they've got to receive dental treatment, or quite often is the case, they have to then pay privately. Whereas at Denby, that's not the case. So obviously for patients, it's fantastic. For the NHS, it's fantastic. But for us, it's a bit of a negative because we are very much restrained to the funding abilities we've got, which is why we welcome so greatly the support from the ICB with the latest ideas and things that we're trying to work towards. So yeah, some really good benefits in the pipeline, hopefully.
That's really positive to hear. Thank you. I'll open up to the committee for any comments. Councillor Downer.
Yes, it seems to me that dentistry has been a great problem for many years. Now, I do very puzzled as to why it hasn't been addressed before. We know that the dentists, their contracts, they didn't get paid so much money, and that's not the point. That was patient care. And the other thing about it is it's like trying to shut the door after the horse is bolted. What I'm sort of trying to say as well is that dentistry, the lack of it, impacts on other areas of people's health, doesn't it? So it's just as important as other aspects of medical care. Thank you.
Thank you. Councillor, James.
Yeah, I know, just on that point, in terms of the healthcare need that poor access to dentistry generates, we are a lot better now at understanding the unintended consequences and where those healthcare inequalities are. So that allows us to be more targeted in terms of intervention. The only point I'll make about historically is this service was commissioned by NHS England nationally and regionally. Since 22, the ICB have been able to get local commissioning responsibility for this. So hopefully it means we can react a bit more in a more informed and dynamic way to some of that local need. So I'm not suggesting that's an excuse, but the reality is it was commissioned differently before. And I think we've got an opportunity to change that moving forward.
Helen?
In response to Councillor Downer, is that you're right. Why don't people come and it's closing the door after the horse is bolted? Because my husband and I were recruited to this island 21 years ago, and we were given grant money to help set the practice up, which we have then done for 21 years. Since that time, 21 years ago, I can't see that anyone else has been recruited with some grant money to put in surgeries, and so it's all very well paying people, but if you haven't got the money to start out a practice or start putting new surgeries in, you're never going to get there. And as you say, that the last time I know it happened was 21 years ago.
Councillor Jarman.
Let me start off by thanking Helen and Edward for their frankness. This committee first dealt with this issue during this 4-year term of the council at a meeting on the 3rd of September 21. I look back at some of the records for that and some of the details of what happened at that meeting, and today seems like a very close rerun of many of the issues that were raised then and the undertakings that were given. Now, I know things have changed, but back in 21, I in particular, and I'm sure I wasn't the only one on the island, found myself inundated with local residents unable to access NHS dental care. Simply unable. I took up a number of those cases on their behalf, and Simon Brown will recall many of the emails we've had exchanged on this topic and with others. And that resulted in a referral that people who needed help should call 111. We tried that many times. It was completely and absolutely ineffective. Absolutely ineffective. There was nowhere that 111 could do other than to tell you to call a local dentist. They would give you a list of dentists. You could ring them up. They would say, we have no availability. We have no availability. We were going on and on and on with this, trying for local people to get them access to dentistry. Finally, on the 21st of September 22, that's 1 year into that process, there was a formal referral to NHS England as to what we should do to resolve this matter, and noting the ineffectiveness of 111 in providing any help whatsoever. That bounced around NHS England for quite some time with a very extensive and very long thread of emails, finally coming out in the spring of 23, where a number of urgent referrals were made through them seeking help with local people. Those included, at that time, some Ukrainians who had very urgent dental need. After about a month of bouncing it around with those people on antibiotics and painkillers, the final recourse, again, as Simon will know, was that they booked flights from Gatwick to Warsaw, were put on trains from Warsaw back into a war region near Kharkiv to a dentist to have treatment in the Ukraine because they could not be treated on the island, and then to come back. An absolute shame, and putting those people's lives at risk in requiring them to do that journey. Later in June 23, NHS England asked us to refer the matter to PALS at St Mary's Hospital. We referred it to PALS with the support of internal resources at the council. And that finally came back with another message here, at which stage Wendy Pereira started to get involved as well, with more referrals and more requests for help as the system was changing. Formal requests for a plan to reinstate universal NHS care for island residents was made in September 23. Those emails went completely unanswered, even to our chief executive. She referred again in March 24. On the 27th of March, sent a follow-up message to Natasha Taplin, urgently asking, what is the plan for restoring universal NHS treatment for island residents? That email went unanswered. She followed up with that again on the 24th of April this year, and currently that email has also gone unanswered. So we are being completely ignored here as a council, even representations from our chief executive officer asking what is the plan for restoring urgently full universal NHS coverage dentistry for island residents. And I still don't know what that plan is or when it will be enabled. Please, can we have a plan?
Thank you. James?
Yeah, and I'll follow up that correspondence. I'll follow that up internally and I'll pick it up with Natasha and make sure we get back to you on that issue. I think there is a plan, there is an investment plan where investments are clearly itemised and the actual sort of activity that generates is clear, but we'll get back to you on that point.
There have been 17 requests.
Yeah, it's the first I've heard of it, so I'll make sure I pick it up and come back to this committee with a full response.
Councillor Nicholson?
Is it just me, or is this the Sharps business all over again? I'm very interested in what Mr. Day might say. It just seems to me that when you said that other dentists use the NHS contract as a loss leader, so implying that there's no money to be made out of it, so you can't sustain your business, but you're managing to sustain your business purely on NHS UDAs. How do you find that possible when others don't?
I think it's quite a different animal at Denby House, only because we don't have all the massive overheads of area managers, procurement managers, all those sorts of things with the corporate system. The other thing that is obviously a slight negative, I'm sure I could spend hours telling you all about the sort of business model and the issues we've got. But we're facing some quite hard issues currently, which is why we're sort of in talks with the ICB. In fact, it all started off with when I first got there, looking at things and thinking, well, how are we going to survive? What are we going to do? Because we've got two dentists. Well, we've got three dentists that commute from the mainland. One has done for 18 years, I think, is it? Yeah. We've got another who's done it for 8 years. And the short and long bit is with the expense of the commute in financial terms, but also in time, it adds 2 hours onto their day, either end. They're now looking and saying, well, actually, I'm not going to, not continue doing that. So, I mean, to give you a rough idea, from the last figures that were sent out, it's somewhere in the region for all of the NHS UDAs that were seen on the island in the previous term of 12 months, roughly 50% of those were seen at Denby House. So if you look at proportionately, the amount of UDAs covered by one, provider under one contract is quite enormous for just a 4-surgery practice. The issues we face are funding, basically. That's what it all comes down to. However you look at it. So the big struggle is, yes, we do get by. A lot of it is we've got some very passionate, dentists and staff that come in for good, the sake of the goodwill of the patients, and they're very passionate about their patients. But there's only so far that passion can be stretched, and walking in and then sort of being faced with this barrage of unhappy dentists, people looking at leaving and looking at alternatives. I mean, we've got dental nurses looking to leave to go and work in other, not at our practice, luckily, but there are many dental nurses that have left the profession and now work in shops around the island. And it's these skill sets that disappear because they're not rewarded highly enough. So one of the big things we do struggle with massively is funding, and that's why we're working so closely currently with the ICB to look at what alternatives we can find for funding, because the actual cost of just existing is going up exponentially, and yet our income is not changing greatly, and that's one of the big issues we've got. So that's why we're looking at, do we just do what the others have done and hand back our contract, or close, or go private like everyone else has? But actually that would be a massive detriment to the island, and it's not what anyone wants to do. But we would have to do that in order to survive through gaining roughly most surgeries that have a split. Most of their income, usually about 2/3, comes from the private sector of their income stream.
So, Chairman, this is the fundamental point, that the NHS contract, dentists can't make a living out of it, can't make it work. So the reality is there is no prospect to increase NHS dentistry on the island, and that's the stark reality as I see it. Is that right, James?
It is a challenge. I think that's why the work with Denby House is so important, because I think it creates a framework by which we can look at similar models elsewhere across the island. We do have flexibility in terms of commissioning. We do have funding that we need to allocate to increasing access. And I think it's an opportunity with Denby House, given the uniqueness of their delivery model, to look not just in terms of what we're paying per unit of activity, but how can we support the business to develop? How can we help with recruitment and retention of staff? How can we help them be innovative? So I think there's an opportunity with Denby House to consider another way of doing things, using the levers we've got. And I think that's why that relationship and that connection is so important, because we can't exist as we are. We have to do things differently in terms of how we contract. So I understand your pessimism, but I'm more positive in terms of how we can use that as an example to roll out.
Councillor Jarman.
Again, let me congratulate Mr. Day on his frankness. From what he said, I would myself, with respect, Mr. Roach, I would hesitate to hold them up as a good example if they were dental nurses who are leaving, and 3 dentists travelling over from the mainland, all of whom seem to be on the verge of not continuing with that simply because of the logistics of doing so. That doesn't seem to be a short-term solution, let alone a tactical plan. It seems to be something which is on a knife edge, and potentially something which could present imminent difficulty for Denby House to continue with the level of resourcing it's done. The example that he uses is very true. I happen to sit in a dentist waiting to see a dentist on Friday. So I'll declare an interest here, personal interest. I listened to the receptionist during that session while I waited. There were several callers. The first one was somebody calling in with a broken tooth. When's the next appointment available? I've broken my tooth. I could hear it very clearly. We have no appointments available. We want to try other dentists. but we can offer you a private appointment. But what have you got privately? We've got 4 o'clock this afternoon or 10 o'clock tomorrow morning. Now, I sat there and I listened to that, and I was absolutely appalled to hear that. I understand the financial reality that people are under, but to have appointments available and a patient in need with a broken tooth, in pain, being told to call around other dentists does not seem to be a good solution. The other 2 callers rapidly afterwards were also told there were no NHS appointments available, and were also offered private appointments in the next few days. So clearly there's a pattern here, and Helen's nodding at me a great deal from behind because she knows exactly what I'm talking about, and I suspect every dentist on the island does. We cannot rely on a system, particularly for those in our community who are less able to pay those private fees, and they are substantial. We cannot rely on a system where they have to continually call around other dentists, effectively pleading their case of pain and misery, trying to get treatment. We need rapidly a solution to it, and it is not a dental bus provided by Dentaid as an independent charity. This requires us to provide urgent dentistry at whatever cost it is on the island for islanders, and to bring people over, put them up in hotels, and whatever we need to do to start cracking through the appalling backlog we've got and stop people who don't have the means to do it, potentially going into debt, for being forced to go private because of the level of pain they have to sustain. Not acceptable. Thank you.
Thank you, Councillor Jarman. I think that is a story that will resonate with a lot of people's personal experiences. I know from my personal experience with staff at my business, we've had lots of staff have to take significant time off work because their oral health got so bad they ended up having to go to hospital. And I repeatedly have staff come and tell me that they aren't able to get treatment and they aren't able to get any relief for the pain they're in. And then I have my family members who go to do a practice for the first time in many years and find they come out with a bill that's almost £1,000. It's insane. I'll pass over to James.
I mean, thank you, Councillor Jarman. I think some of the practical actions you listed are possible within our commissioning responsibilities, but I'd just like to remind the committee as well that we are at the behest of the national contract. We have to operate within the national contract, and as the paper highlights, that contract will need reform. It's not due to be reformed till January 25. I mean, we're not obviously can't speak about that in detail given the current political landscape, but there's a much needed need for reform of the national contract. And until that plays through, there'll be certain things we've got to deal with the hand we've been dealt, if you like. So that national contract is very challenging. It does need national renewal and national reforms. I think it's important the committee are aware of that in terms of context.
Thank you, James. I did note in the paper that I found quite interesting that under the terms of the contract, if a patient needs a filling correction, root canal treatment and a crown under the treatment plan, the dentist will be paid for the crown only, as this is the highest level of activity. Running a business where you're only paid for one part of the work seems quite shocking. I'll bring in Councillor Lilly had a question, and then Councillor Jarman.
I just wanted to say that I was quite grateful for the ICB and Denby House to have a meeting, and it was in my role then as chair to actually bring forward, because I think it's important to note here, Denby House in 2023 was viewed as one of the best dentists in the whole of the UK. And I think at the previous meeting, I raised the issue, why do we have the best dentist in the UK, right? Award-winning, and we have this issue, this huge issue, which has been very eloquently outlined by Councillor Jarman. I think that the positiveness of that meeting was at least their dialogue has actually started, which hadn't been fully going previously with that practice. So it started, And there was a very strong dialogue about the needs of children, because I have children in my ward who have never seen a dentist, right? Within that, and actually have appalling teeth, and will go into adulthood with that. So at least there's been now a dialogue which has involved the children's services, education, and public health with the ICB and Denby House to actually look at sort of solutions of that. So that's a sort of positive move, but it doesn't get over the bigger fact that unless we dentists like Denby House get an increase in the UVA, right? They will not be able to compete with their private counterparts. There are cases where those private were approaching Denby House dentists and offering them £20,000 handshakes to actually join them. I mean, how can you compete for that? So I think we really need to thank Denby House for keeping to their principles. They're a wonderful group of dentists, to their principles, to actually get a service to all, because that's what the NHS is about. Because there's a lot of people now, the cost of living crisis, things who cannot afford even the kind of payments that a private plan involves. And so we do need to champion Denby House. And I think their particular point that they're doing 50%. So one practice is doing 50% of the NHS on the island. Well, we do really need to be investigating this further and really working on that. I think there's some bigger questions which I won't go into the politics of, but we do need to get increased UVAs. Otherwise, the reality is that practice like Denby will wither and die, and we cannot on this island allow that to happen.
Thank you, Councillor Lee. I'll go over to Councillor Jarman.
I think this might also be another example of why an island deal that respects the differences of an island is so important. And I'm sure in your discussions, you'll take that forwards. We happen to have a couple of prospective candidates here. I'm sure they won't be immune to that topic of debate either. But eventually, we do need to get to a situation where this island has a way forward. And, although I respect, James, what you've said today, which is useful, and we'll look forward to the replies to that. Maybe we could also invite the two dentists who we've got sitting at the back and at the front, in terms of them actually suggesting what would it take, what can we do as an island, what can be done on this island to improve the situation. I don't want to put you both on the spot, but there is an opportunity, if you can contribute to this debate afterwards, to let us know your thoughts. What can we do as an island in the short term to improve this situation? You're at the coalface here. You see what's going on every day. You nod when I talk about the issues we face, and which the chair has echoed as well. I think we all know the problems we've got. What we don't seem to have is an imminent solution, and perhaps your perspective can be very valuable in that exercise. I'll leave that with you without it being a formal question, Chair.
Chairman, I think it would be remiss of this committee if we didn't pass a resolution on this, and taking Councillor Jarman's comments on seeing a plan. I think the reality of this situation is not very bright, and I think that this committee, I'd like to propose, if you don't mind, Chris, that we ask for a plan that is realistically going to improve NHS dental services, given the constraints that we've discussed. If we could have that perhaps for the next meeting, 3 months, is that unreasonable? So that's a proposal. Have we got a seconder? Yeah. Yeah. Yeah, please, Chris.
amendment to that, could we ask for it to be in 2 months so that it's 1 month ahead of the next meeting? So we've got time to debate it before the meeting and resolve any issues with it. So if we can have that within 8 weeks, that would be very useful. I'm sure if there is a plan, and the echo I got earlier was that there is a plan, we just don't know it yet. So perhaps if we could receive that with any addendums you want to make, and maybe taking on board the contributions as well that would come in from the dentists who are in the room in 8 weeks, and then bring it forward and make it an agenda item again for next time. You'd be happy to accept that?
Indeed.
Yeah, and in response, there's a local plan with local actions within the sphere of our local responsibility. Obviously, the caveat to that will be the NHS England element as well, which I'll signal, and we just need to be clear in terms of where they are around dental reform. But I'll clearly